pattern baldness is the commonest type of hair loss that develops in most men at some stage. The condition is sometimes called androgenetic alopecia and can take around 15 to 25 years to become noticeable. Nearly all men have some hair loss by the time they're in their 60s, however this can vary. It is estimated that about 3 in 10 men aged 30 years or older have significant balding. To become gradually bald is a normal part of the aging process, and as such, no treatments often wanted by the majority of those affected. However, when the balding process occurs in earlier life, or the patient's quality of life is significantly impacted by it, it is well worth exploring what you can offer your patient as a doctor. Sex hormones can cause hair loss by impacting the hair growth cycle. The male sex hormone testosterone converts to a form called DHT, or dihydrotestosterone. DHT shrinks hair follicles, which impacts the quality of hair, leading to more fragile, finer hairs that soon fall out. The hair cycle has 3 phases: anagen, when we grow hair; catagen, when growth of hair pauses and follicles shrink; and telogen, a resting phase that can go on for 1 to 4 months, sometimes longer in certain disease states. We get hair loss when any of these active phases are impacted. Causes of hair loss include skin infections, radiation, and trauma to the skin. Other medical states that cause hair loss include anorexia, hemorrhage, being pregnant, and undergoing psychological stress. There are other systemic diseases such as thyroid dysfunction, SLE, syphilis, and various severe acute and chronic illnesses that play a role in hair loss. Treatments for hair loss vary and include tablets, ointments, and surgery. A commonly used medication is called finasteride, which is actually a medicine used for prostate problems. It works by converting testosterone to DHT to prevent further changes to the hair follicles, allowing the follicles to enlarge and hair regrowth. It can take up to 4 months for any benefit to be noticed, and sometimes 1 to 2 years for maximal benefit. It is, however, a private prescription and not available on the NHS, and once you stop using it, the process of DHT causing hair loss restarts. Minoxidil is another treatment. It's an ointment that's rubbed on and available in 2 strengths. The mechanism by which it works is still under some debate, and its success is somewhat arguable. A third option, and something a bit old school, is a wig. Modern wigs are very realistic and an option for some, however they're again only available privately. Lastly, scalp surgery is an increasingly popular method and has a more permanent lasting effect. However, this is dependent on the surgical technique, aftercare, and can be quite expensive, leading to lots of health migration to other countries.